Today, we're going to be going over a critical appraisal of evidence-based physical examination for the diagnosis of subscapularis tears, a systematic review by Dakkak et al., published in January-February 2021. For the search strategy for the systematic review, they use PubMed, Medline, Ovid, and Cochrane Reviews databases. Search terms were subscapularis, rotator cuff, examination, and clinical. The results, so the initial search identified 3,165 studies, and all were systematically reviewed per PRISMA guidelines. After the exclusion criteria, we can see the whole flow screen, the flow chart on the right-hand side in that diagram. Only 5 studies were included in the quantitative analysis. So the objective of the study was to perform a literature review to evaluate advanced maneuvers and special tests in the diagnosis of subscapularis tears and create a diagnostic algorithm for subscapularis pathology. The PICO being P for testing patients with suspected subscapularis pathology, I being to diagnose patients with suspected subscap pathology using advanced maneuvers and special tests, C being compare advanced maneuvers and special tests to the gold standard shoulder arthroscopy or MRI, and O being to confirm the subscapularis pathology in the patients that are being tested. The study design is a systematic review, the level of evidence being level 2. Looking at the study details, so the purpose, identifying these level 1 and level 2 clinical diagnostic studies that evaluated physical exam maneuvers and special tests for that subscapularis pathology. 5 studies were included, and they provided numerous special tests, some being the bear hug, the belly press, Gerber liftoff, Napoleon, internal rotation lag sign, etc. And these were all compared to the gold standard of shoulder arthroscopy or MRI. Inclusion criteria being that they had to be level 1 or 2 studies published in peer-reviewed scientific journals that focused on the physical exam. Of interest was the evaluation of subscapularis tears. Exclusion criteria being any studies not published in English, not available in full text, level of evidence is a 3 or lower, and did not evaluate the pathology of subscapularis tears, or they didn't apply a validated gold standard being shoulder arthroscopy or MRI. The methods, so using the 5 studies, special tests were identified and evaluated separately and in combinations, and then they were compared to the gold standard. The tests that were used were the bear hug, belly press, lift off, Napoleon, internal rotation lag sign, belly off, IRRT at 0 degrees, IRRTM, painful arc, Hawkins-Kennedy, and NIRS. Combinations of the special tests were used either in series or in parallel. We used the bear hug plus belly press, the bear hug plus Napoleon, belly press plus Napoleon, belly press plus IRL, and bear hug plus liftoff. So looking at the methods being in series and parallel testing, they wanted to compare the difference between series versus parallel testing methods to determine which is better for diagnosing subscapularis tears. And we can see Figure 2 discusses the statistical analysis for the series and parallel testing methods to gather that information. Looking at the diagnostic values of just the single tests themselves, we can see that the positive predictive values for the belly off is high at 10.11. The rest aren't great, but we can see that the negative predictive values for the belly off again, not too bad. And then the rest of them are a little bit higher. Also looking at the sensitivity and specificity, belly off has a specificity of 91, sensitivity of 87, that being the highest on the chart. Now we go into diagnostic values of special test combos performed in series. So we look at the bear hug plus belly press. We have a high specificity and a high positive likelihood ratio at 18.29. All of the other positive likelihood ratios are good, but we can see that the bear hug plus the belly press has the highest one. Looking at the special test performed in parallel, we still see that the sensitivity for the bear hug plus belly press is high at 84%, and that negative likelihood ratio is the lowest at 0.21, which is moderate. Results. So with series testing, 3 different special test combos demonstrated a specificity of 99%. Bear hug plus Napoleon, belly press plus Napoleon, and belly press plus internal rotation lag. Bear hug and belly press, however, though, that combo produced the highest positive likelihood ratio of 18.28. So we see with parallel testing, bear hug and belly press had the greatest sensitivity at 84% and that lowest negative likelihood ratio at 0.21. No combination through this testing method created a significant impact on post-test probabilities, though, however. See, since this was a a systematic review, we did do a Prisma checklist. So as we can see, there were some areas that were unclear. Defining all other variables for which data was sought was a little bit unclear. They didn't really describe any assumptions made or about any missing or unclear information. And then they also didn't really talk about registration information for the review. They didn't talk about the review protocol or state the protocol that was prepared. They didn't really explain any amendments or information provided at the registration, any financial or non-financial support for the review, or any competing interests of review authors. So take-home points for this systematic review. So the bear hug and the belly press test physical exam maneuvers in series is an optimal combination for evaluating subscapularis pathology. We saw that it had a high specificity and a high positive likelihood ratio. The study, however, does have limitations. It only used 5 total level 1 or 2 studies addressing this topic. So we have to consider the patient population, variations, also clinician differences in performing these special tests as well in order to see which tests or which combinations, whether in series or in parallel, we would use to diagnose subscapularis tears versus the gold standard of shoulder arthroscopy or MRI.